Teddy bear hospitals, huh? Gotta say, when I saw this deep dive request come through, I thought, okay, now that's different. But then I dug into this research you sent, and wow, this is fascinating stuff.
Right. It's this really neat approach to helping kids deal with, how scary hospitals can be. Basically, a teddy bear hospital is like a practice run for a real doctor visit, except, well, teddy bears are the patients.
So you're saying it's about taking the fear out of seeing a doctor by making it a game.
Yeah, exactly. And these programs, they're often run by med students or healthcare professionals. They give kids this safe, fun place to get familiar with medical equipment, learn about health, even practice taking care of their teddy bear patients. And what's amazing is this research shows it can actually make a real difference.
Okay, now you've got my attention. What kind of real difference are we talking here?
Well, the paper does a great job, really, of laying out the findings. They focused on three main areas: how teddy bear hospitals affect how kids feel about healthcare, how they act during actual appointments, and their overall knowledge about health.
Okay, so breaking it down then, let's start with the feeling part. Did these pretend visits actually make kids less anxious?
It seems like they did. The research mentioned several studies where kids who went through a teddy bear hospital program, they were definitely less anxious compared to those who didn't. What really stood out to me was that some studies even used control groups, which, isn't always easy to do, especially when you're talking about something as, well, playful as teddy bears.
Control group. Okay, yeah, that definitely makes the results stronger. And it makes you wonder, I mean, did being less anxious actually change how kids behaved in real life situations like at the doctor's office?
It did, actually. They found that the kids who'd been through the program were way more likely to follow the doctor's instructions after. Think about how important that could be during an actual appointment. Could make things so much smoother for everyone, the kid, the doctor, the parents, everyone, really.
Makes total sense. And that whole behavior thing makes me wonder, did they actually learn anything from this whole experience? Or was it more just about feeling better in the moment?
No, it seems like they really did learn. The studies found that the kids actually picked up knowledge about health just through this playful interaction with the teddy bears. And it wasn't just assumed, they actually tested their knowledge before and after the program.
Wow, that's really something. So they weren't just playing pretend, they were actually learning how to be healthier in the process.
Exactly. And what's even cooler is where they see this research going. They started talking about using EEGs in the future, those brain scans that show electrical activity, to see how this kind of play actually affects the brain.
Whoa, okay, now we're talking. Tell me more. How would they even use EEGs for something like this?
Well, imagine, right? You could actually see how a kid's brain lights up when they, say, put a bandage on their teddy bear. EEGs could show us what parts of the play experience work best to reduce anxiety. And then you could take that information and make those parts even better, even more effective.
That's incredible. It's like we could figure out exactly why this type of play is so powerful.
And it's not just about hospitals, really. This got me thinking about how valuable this could be for neurodivergent kids, too, like those with autism, because, processing sensory information can be really tough for them.
Yeah, I see what you mean. A controlled environment, but also playful, that could be really, really beneficial.
Exactly. And another interesting thing, the research wasn't just from one place. They looked at programs in Europe, Asia, even a bunch in Australia and Malaysia, which I thought was interesting.
Malaysia. Now that you mention it, that does make me wonder, is there something about Malaysia specifically? Why so many there?
That's a great question. It's actually something we can come back to later. Because one thing they stressed was the need for more research that includes different cultures. Because what works in one place might need some adjusting for another.
That's a really good point. I mean, healthcare, even just the idea of what being sick means, that's different everywhere. It'd be fascinating to see how those differences play out when you're designing a teddy bear hospital. Right.
Absolutely. I mean, imagine a teddy bear hospital in a culture where traditional healing is really important. Could they work that into the experience somehow? It's exciting to think about. But first, I think we should get back to those future implications. There's some really interesting stuff there.
Yeah, using EEGs to study teddy bear hospitals, I mean, it's like you could get this whole new level of understanding about how play affects kids' brains, right?
Yeah.
Like we could actually see what's happening when they use their imaginations like that.
It's kind of mind-blowing. We could figure out exactly which parts of the experience are working best, maybe even tailor it for each kid.
Right. Imagine that personalized teddy bear hospital experiences,
Hmm.
all based on what's happening in their brains. That could totally change how we get kids ready for medical stuff, maybe even lead to new therapies. Who
Yeah.
knows? Amazing.
Mhm.
But even without all the high-tech brain scans, this research, it's already got some interesting angles, especially for neurodivergent kids. That part about autism really stood out to me.
Yeah, they were saying how teddy bear hospitals could be really helpful for kids with autism because, hospitals, all those strange sights and sounds, that can be super overwhelming, right? But imagine if there's this safe, controlled space where they can get used to medical equipment and procedures all through play.
Yeah, it's like desensitizing them, but in a fun way, not clinical and scary.
Exactly. So they start to have positive associations with healthcare instead of being afraid. Makes a huge difference for the families, too.
Definitely. Shows you how adaptable this idea is, right?
Yeah.
You mentioned earlier the research focused on Europe, Asia, lots in Malaysia even. Did they ever talk about the cultural side of this? Like, does it work the same everywhere?
They did. There was a whole section in the paper about it, how we need more research that includes different cultures, because what works in one place might not work somewhere else, right?
Right.
It's common sense when you think about it.
Makes sense. Healthcare is different all over the world, even just how people think about being sick. It'd be so interesting to see how they design a teddy bear hospital in different cultures, wouldn't it?
Oh, absolutely. Like, imagine if there was one in a place where traditional healing was really big.
Yeah.
Could they bring that in somehow? So many possibilities.
So cool. Did they have any concrete ideas in the paper about adapting to different cultures? Or was it more like big picture stuff?
They're really stressing how important it is to get local communities involved, the people who actually live there, the healthcare providers, everyone, because they're the ones who understand those cultural differences the best.
Definitely. Not a one-size-fits-all kind of thing at all.
Exactly. And that's what makes this research so interesting to me. It's not just about proving that teddy bear hospitals work, it's about understanding how and why they work and how we can make them even better for kids everywhere.
Like they've given us a whole new way to think about this, using play to make healthcare less scary, more approachable for any kid.
Exactly. And what's exciting, I think, is that it makes you challenge those old traditional models of medicine and remember how powerful play can be.
Seriously. I mean, if playing doctor with teddy bears can do all that, what else are we missing? I mean, it makes you realize play, it's not just kids messing around, right?
No, not at all. It's how they figure stuff out, how the world works, how to deal with things.
So teddy bear hospitals, like they're tapping into that, helping kids practice for tough situations, but through play.
Exactly. And it's not just about hospitals either, right? Think about it. It's teaching them about health in general, encouraging healthy habits, even just that feeling of, hey, I can do something to feel better.
Giving them a sense of control, right? Setting them up for a lifetime of good choices, hopefully.
Exactly. And this research, it's really just scratching the surface. Imagine if we took this idea of play and used it in other areas of healthcare. Like, what about mental health? Or helping kids with chronic illnesses? Oh, wow, yeah. Like a teddy bear support group for kids with diabetes or something. Or, I don't know, a program where they can act out different ways to deal with anxiety.
See, so many possibilities.
Yeah.
And it all comes back to this one simple but powerful idea. Playing pretend. It can heal. It can teach. It can give kids the tools to handle whatever life throws at them.
This whole deep dive has been amazing. I never would have guessed that something as simple as teddy bear hospitals could be so profound, really.
It just goes to show sometimes the best solutions are the ones that are right in front of us. We just got to be open to seeing them, remembering how powerful play can be. Absolutely. And to everyone listening, we'd love to hear from you. Have you ever encountered a teddy bear hospital? Did you have one as a kid, or maybe your kids did? Tell us about it. Keep this conversation going in the comments. And until next time, keep those brains buzzing.